welcome back to Spectrum Healthcare, another one of our live streams. And today we're going to be talking about STD Awareness Month, that is April. And there is an awareness week in there as well, the 11th through the 17th. But specifically, we're going to be talking about the risk factors around spring break activities, what you need to know, what you're at risk for, what the signs and symptoms are, and when you should get tested. And I'll be joined today by Laura, who is one of our interns. She's been with us for, well over a year at this point. She's been involved with our research, but she's also one of the interns who is in our clinic doing the testing. And then our community health worker superstar, Allie, is going to be in the chat with us today as well. Allie oversees our interns for us. And she also has really revamped, in the utter chaos that is COVID, our testing protocols, has lined out new policies and procedures, streamlined our process, all while also being a community health worker and being a part of the Right Time Initiative, which is our contraceptive connection program, which we have time today. We'll talk a little bit about. But let's go ahead and bring them in. Hello, everybody. And Allie, we don't have a picture of Allie. We lost Allie for a minute. She'll jump back in here for a second. But Laura, welcome, and thank you for taking time out of your spring break to be with us today. Let's just jump right in, and we'll start, since we have you on the chat, with talking about the end process. So we'll talk about things backwards. You suspect something has happened. You might have some symptoms, or it may just be your routine time for testing. What happens? What's the first step for connecting with Spectrum to get some testing done?
Yeah, of course. So when you have that moment, you think something's going on, or like you said, routine, we're going to give our clinic a call, and we're going to do a pre-screening call first to find out what's going to be the best type of testing for you. And then once we do that, we'll book your appointment, and then the day of your appointment comes, you're going to come in, get checked in, and once we call you back, we're going to take you back to our testing room, and then we will have just a little bit of a conversation talking about any symptoms you're having, how many partners have you been using protection, some of just behaviors you've been having in the past, just to best narrow down if there's specific testing we don't really need to do or do need to do, or along with that, if you just need automatic treatment. So with that, once we come in, we can do a variety of tests. And so whether it's for gonorrhea or chlamydia, you'll be doing a urine sample. So nothing scary, you just give us a sample in a cup, and we'll make a process sample for that and send it off. Or if you want to do something like HIV, it's a finger prick, very easy, not scary. And so we'll do that. And then for syphilis, we have two options at our clinic. When we give you that test, we can do a rapid syphilis test. That will be also a finger prick test, very non-invasive. Or if you want to, we can do a blood draw. So we'll have our nurse, usually Melissa, the wonderful Melissa, will come in, and she'll do a blood draw, just on your arm, and we'll send that off instead. And so those are the big ones that we see to come get tested most often. But we'll do that, we'll process it, and we'll sit down talking about what things could potentially look like if you test positive. And when that does happen, it's usually a pretty calm process. We come in, we'll give you medication and talk about the stipulations for that medication. And we'll send you on a merry way, usually with a little goodie bag. Our prevention packs that we've created, they will have things such as condoms, lube, more information about the clinic and initiatives we have going on. And we just make sure we're setting good boundaries, if we test positive, make sure we're not having sexual activity, and making sure every patient knows, things are going to be fine, and just give it time and things will settle on. So, yeah.
Okay, now that we've got Allie back with us, we come back issues. Yeah. we covered the back end of the process. So what happens when you think you have something going on? So we know that, you know, a lot of people have been cooped up for a long time and they've made their plans to travel for spring break, which is great as long as they're remembering, you know, all the COVID rules and keeping themselves safe, or hopefully they've been able to get vaccinated. What are the things that, so you're on spring break, you find yourself in a situation and you've had unprotected sex. What are the things that you could potentially come into contact with, like the big stuff? I mean, there's a long list, but what are we're really talking about?
Yeah, and so if we're talking about spring break aged people, so young adults, 18 to 25, that young age group, they have a higher prevalence of some of the more common ones that we see, like chlamydia and gonorrhea. Those are.
Yeah, I'm going to stop you. You've got some audio issues. You sound like a robot, which I know in real life you don't. So,
Is this better?
Nope.
Is this better?
No. That is so bizarre.
You unplug your headphones and see how it sounds like that.
Is this better?
Yes.
There we go.
All right. So go ahead. We were talking about what your possible risks are for.
Yeah. So if we're talking about spring break aged folks, so those like between 18 and 25, the younger adult population, they have a higher prevalence of some of the most common ones that we see, chlamydia and gonorrhea, and even up there would be syphilis, but we're really talking about chlamydia and gonorrhea. And those are two within that age group that is most prevalent. And there's a lot of statistics around it, but basically 1 out of 2 sexually active 18 to 25-year-olds will have chlamydia or gonorrhea in their lifetime or in that time frame. So if you want to think about it that way, you might as well be the one to prevent it. So
sure.
I know a lot of times people have a recent exposure. So say someone went on spring break in Florida, and on the Saturday before they leave, if they're leaving Sunday, they have a fun, unprotected encounter, and they're a little worried about it. The best things that you should do for you before you freak out is just calm down. It's okay. We have testing available, and also one way to minimize any risk is to minimize the partner. So stop having sex until you're able to get tested and make sure that you're fine. Because you could spread that unknowingly. You might not know you're infected because a lot of those are asymptomatic. Chlamydia and gonorrhea, a lot of people don't have symptoms. So that's another thing, is you might not know until you either are symptomatic several weeks down the line, or you are just spreading it and not knowing. So the best thing for you and everyone else is to stop having sex and get tested ASAP. We want to make sure that we have enough time between the time of exposure and testing window, though. So to make sure that the test you get gives you accurate results, you need to wait at least 5 days, is what the CDC recommends. But we want you to come in and make an appointment after that time window. So that way your body actually has a chance to show if you're positive or not. That's a big thing, is if you were exposed on that Saturday and you call and make an appointment Monday morning, well, if your contact was on Saturday, then your body doesn't have a chance to show that you have that bacterial infection, basically. Like, you could have been infected, but to a test, you would be uninfected. So you need to give your body some time, kind of like the COVID testing window. That's probably more relevant. If you had a COVID exposure yesterday, you need to wait a few days to get a test. Otherwise, it might tell you that you're negative when you're really positive. You just don't know it yet.
Yeah. So, and with chlamydia and gonorrhea, and they're a little bit, I guess, on the clinical side, there's not as much to get up in arms about. We want you to get tested. We want you to get treated for sure. But
Luckily, those are
immediate risk.
Yeah, luckily those are the two treatable ones, with antibiotics, appropriate antibiotics, and timely antibiotics. But there are cures for those. Now, if left untreated for a long time, that's when we're talking more serious complications. But that's later on down the line. If you address it early, then you will be fine. You'll be totally fine. We'll give you treatment, and you'll be retested within after 3 months to make sure your system's cleared it out. So that's what we would recommend for someone who did test positive.
And that's true, that window of time is kind of important. When we talk about HIV, there is a window of time. If you believe you've been exposed, then there's that window of time when you can get post-exposure prophylaxis treatment to prevent the virus from taking hold. And that's also true of our syphilis tests as well. We've seen increases in our syphilis rates. So it's out there and as a risk factor, but the earlier you get tested and treated, the less likely you are to have any bad stuff happen.
Yeah.
Like any health condition, though, that's true of any health condition. The longer you wait, the longer you ignore, the chances are greater that you're going to have a complication.
And syphilis and HIV are the two that definitely are out there. And those are ones that symptoms typically will be more apparent than if you leave it untreated. They will come to surface a little bit sooner than chlamydia and gonorrhea. I know people who were infected, who have come in and they were infected about 2 months ago, and they still are completely fine. They have no symptoms, and they wouldn't have known unless someone had texted them and said, "Hey, I tested positive." So unlike chlamydia and gonorrhea, HIV and syphilis have a little bit more extreme symptoms if left untreated. So,
just to give you an idea, we're, Columbia, Boone County, 2020 probably isn't a good measure of what really happened. Everything was surreal in 2020, but still we had 387 new chlamydia infections, 155 gonorrhea infections, and 8 syphilis infections in 2020. But then when you compare that to 2019, which is probably really a better reflection of what the normal cycle is, we're looking at 1,452 chlamydia infections, 562 gonorrhea, and 54 syphilis cases in Boone County. And just for clarification, those numbers get attributed to Boone County if you're tested in that county. So if you're a student living in Columbia and you're tested here, you'll be counted here. But if you go home to your primary care physician, that number gets associated with wherever the county is. So it does skew numbers, and the HIV data isn't released in these provisional reports from the state, but we know that we continue to see new cases of HIV showing up in our clinic for treatment, people who are tested in our clinic. So we know that these are still factors. So you talked a little bit, we alluded to there being symptoms, and sometimes there's not. But if there are symptoms, let's talk about what we can expect if that's in our system. And we'll start with chlamydia. And
chlamydia is one that women typically will have symptoms a little bit sooner than men. But for both men and women, burning, especially when urination, increased frequency to have to go to the bathroom, even if it's just a little dribble, and also some itching and discomfort. But it can have discharge, like a white-ish discharge, although discharge is more of a telltale sign for gonorrhea, but not unlikely to have with a chlamydia infection, or if you have a co-infection of both of them and it's just really uncomfortable. But
And I think
That's what we see.
yeah, important that when you come in and you're meeting with Laura or another one of our interns or staff, that you get the better information you can give us, the more we can help you. So if your sexual exposure is rectal or oral, we need to test those two areas as well. As we can do a vaginal swab, we can do a rectal swab, we can do a pharyngeal swab. Rectal and vaginal are self-administered. Pharyngeal, we actually take care of that for you. That's the back of your throat, as well as a urine collection. We want to make sure that we're not missing an infection that's setting up shop and could be problematic long term. So, but again, if there's no risk factor for those things, we're not going to recommend doing those.
And that's when I say when we have conversations with patients and I have them sit down and I ask, well, I always ask, what brings you in today? Because although what they say when they make the appointment is one thing, it could totally mean something else. And anytime someone says, oh, I'm just here for routine testing, I just want to make sure I'm good. We don't leave it at that. We actually want to have a conversation and say, well, how are things? Is everything normal down there? Because most times people know what's normal and what's not. And that is a telltale sign. If something is off, then talk about it, because it definitely might be something that we can help out with. But if you're not honest, then we don't really have the right tools to help with that problem. So if you're honest with your intern or your healthcare provider, that goes a long way.
And as a group, as Spectrum Healthcare, we are a completely judgment-free zone. There is all we're trying to do is collect the best information that we can, so that you walk away with the best information and outcome that you can. We really are not concerned with the mechanics of what brought you in the door.
We've heard everything, and I promise you, your story is not that unique. It won't faze us, and the more honest you are, the better care we can give you. Because if you tell us one thing and it really is another thing, then we've missed out on taking care of you the best we can. So we're just in it for you, and whatever you tell us, we've already heard.
Yeah. So, okay, going back to our diseases. So we know chlamydia and gonorrhea are similar, different bacteria, but kind of look the same.
In the same symptom family, similar family.
So what about syphilis? What do we look for?
Syphilis, well, if it's caught early enough, you will develop sores, and those are painful. If you have a syphilis sore, you would know. It's something that is not comfortable, and most people, that's one of their first signs. But another sign is rashes on the palms, especially, but rashes, red bump rashes, more specifically on hands and feet and legs. That can be a sign that syphilis, you're in the early stages of it. That's what we see. And we don't see that often. We don't get syphilis diagnoses often, but it is definitely out there. So,
yeah, we, syphilis is often referred to as the great imitator, because those symptoms are, if you talk through them, you make the list. You know how a lot of things can seem like, oh, well, that's the flu. If you just list all the symptoms, it's easy to say, oh, well, you've got the flu. Syphilis works in a lot of the same way. So you've got all of this stuff going on, but it doesn't last for very long. That's kind of the big thing. The initial sore, which you can miss. It depends on its entry point.
that's a good point. Not always visible.
I don't know if it's just me, but I'm not naturally graceful, and we live in kind of a pointy world. So having, some part of your body that the skin is broken and there's something healing over is not tremendously uncommon. So it's easy to pass that stuff off. And then you talk about rash. The dead giveaway on the syphilis is the where it's at. If it's palms of the hands and soles of the feet, we need to have a different conversation than, oh, you need to go see your dermatologist. But like rash is a rash is a rash. They're really, really hard to pin down when they're on your body. So location is important on syphilis. And really, we would prefer to catch it when it's in that primary syphilis stage. So rash is secondary syphilis, primary is the sore. And, you can come in and get the injection and clear that up. That is treatable, curable in primary and secondary syphilis. When you get to the third stage of syphilis, it gets a little bit more complex and may require a hospital stay and IV antibiotics, especially if it's moved into the brain. But for the purposes of, talking about spring break, it's not that fast. Syphilis, it's that long-term, don't wait thing that's,
And with the sores in the primary stage, I know that they can pop up and they can quickly disappear within 3 to 6-ish weeks. So you do have a chance to kind of miss it that first initial breakout, and then it goes away and you're like, oh, well, it went away. It's fine. Mm-hmm. And you do need to get tested early because that window is kind of small. So,
yeah. And we all know this because we work with it, but that chlamydia is the one that we see the most of, and it's kind of a descending cascade: chlamydia, gonorrhea, syphilis, HIV. I do think it's probably worth mentioning, though, trichomoniasis in the bunch. Mm-hmm. We can't test for that through our Spectrum STI testing panel, but we can get you over to the clinic side to get that diagnosis.
And our nurse practitioners, especially Lola, she's dealt with that a lot. And usually I think it's just a visual determination. And that's done with our nurse practitioner. You won't have to do that with a traditional STI testing appointment, but it is available for those who are there, and she's able to help provide treatment for that. She's pretty well versed in that, so that's kind of her sphere.
So if you want to avoid having to, first, everybody needs to get tested, with or without risk. If you're a sexually active person, you need to get tested, period. But if you are interested in mitigating your risks, Laura, what do you recommend when you're in those situations and somebody comes in and they really, okay, well, how do we stop this from happening again?
Right. I think the thing I see most often with patients who come in relating to these issues, they don't use protection during their sexual encounter. So the first thing, make sure you're always using protection. And then second, really reduce the number of partners you have if you can, if, that's an option. So make sure, number one, always use protection. That's the thing I find myself repeating to my patients. We need to make sure we're using protection during our sexual encounters. Like, you can make it fun. They have different types of condoms we can use. Like, it can be fun. But that and reducing the number of partners are the biggest ones we see for like risk behaviors that can really reduce coming in. Making sure, if you're using an app like Bumble, Tinder, Grindr, whatever app, there's so many of them now. If you're talking, like, it's not the sexiest things, but it's good to ask, like, hey, do you know, are you clean, or have you been tested lately is a better way to ask. Have you been tested? And it's always nice to have that. It's not a official, it's not like you have the piece of paper with you from your test, but if that person, make sure they have been tested themselves, make sure they're taking that action to do so, it helps a lot. So
starting that conversation with your partner, I think, is step one too.
I have couples come in all the time.
Yeah, and that's a great way to do it. And you hit the nail on the head. Condom usage correctly and consistently. It's not just putting a condom on. There is a correct way to do it. And we would love to take the time to tell you that during your STI prevention appointment, and do that. And we also have free condoms. Another one is reducing the number of sexual partners, because just by math, you reduce the number of people you're exposed to by limiting the number of people that you are intimate with. Another one I think that would be really a good option for people to add is mutual monogamy. And those people who are either in monogamous relationships or monogamous sexual relationships, being on the same page that they're mutual, that can help limit your risk as well. So we've had people who are in that zone where they're only sleeping with each other, and they're coming in to get tested and making sure, because that's their decision that they're making. And just being aware that it's a mutual decision and that both people are understanding that it's mutually monogamous.
Yeah. Monogamy is kind of a hard target to hit, especially within our highest risk group, which is, 15 to 25. Towards the end, you start to see monogamy happening more regularly, but certainly in that younger population, they're, figuring it out.
I mean, when it comes to communication, so being the best team to prevent all of this, talking with your partner, whether, it's a long-term serious partner or just a casual, benefit friend, we need to have those conversations no matter what. Like I said, they're not the most entertaining, sexiest conversations to have necessary, and they can help prevent a lot of cases in the long run.
And it can improve your intimacy if you're able to talk about sex and what you like and what your boundaries are, and your prevention stuff. Like, that is a great foundation, I think. But it would be naive of us to tell everyone just only sleep with one person when that's not the case.
And I think there is a misconception around when we talk about limiting partners. We're not talking about limiting the frequency of intercourse. Like, you can have as much intercourse as your body can handle and the other body can handle. Go for it. But the total number of bodies that are in that equation, the more you can limit that total number of bodies, you reduce your risk. And it reduces by a lot every one less person that you have in your circle of sexual partners. So, and then I just want to circle back to prevention, and that we're talking about barrier methods specifically, because that is the easiest and most accessible method for most people. Like, we can give that for free, and that's male condoms. We still can get you a script for female condoms if we need to, because those are prescription only now. Dental dams are another usable item. But another thing that people may want to incorporate is PrEP, which is protecting against HIV infection. If you feel like your sexual experiences put you at greater risk for that, we do have PrEP clinic that we can get you connected with. So that's just taking a medication once a day to prevent HIV infection.
I like to explain PrEP when I'm talking to patients who would be a great candidate for it as, in layman's terms, if birth control pills you take every day at the same time of day to help prevent the chance of getting pregnant, you take this if you want to every day to help reduce your risk of HIV transmission, if that specific issue pertains to you. And it is a great medicine, and cost is not a factor anymore as of January. It shouldn't be for most people. For people who have private insurance, it's finally now listed as a preventative medication, which it always has been a preventative medication, but it wasn't always categorized in insurance purposes that way. So now it should be free or low cost. And then also, if you don't have insurance, Gilead has an amazing patient assistance program to help with getting access to PrEP, and we can help take care of that steps too if you're considering getting PrEP.
Yeah, and I think in that same line, when you come in and get tested, depending on what you get tested for, there may be cost associated with that. If you're selecting expedited testing, if you're getting other additional tests done, there may be cost, but you'll know that upfront. We won't do anything and then surprise bill you on the backside. All of that's upfront. All the rest of our testing, we do ask for donation for our testing services. Whatever you can give to help us cover the cost of all the supplies and staff and everything that's associated with that testing is greatly appreciated, but we'll never turn away anybody for their inability to contribute. And then on the backside of that, if we have to provide treatment for chlamydia, gonorrhea, or syphilis, that's provided at no cost. We provide that treatment for you and your partners who are potentially exposed as well.
So that's why we encourage donations, because it really, if worst case scenario happens and you come to be positive, then that donation has helped cover your treatment, so to say. Yeah. And I don't think they'll find anywhere else that is as affordable.
Yeah.
For both.
We try really hard to create a system that is affordable and attainable for our target population, which we know are people who are, students early in their careers, not a lot of disposable income. So we are cognizant of that and try and keep things affordable for that.
And I also tell my, sorry.
Oh, go ahead.
I was going to say, I also like to tell my patients too, and with that donation too, it helps with other patients as well with their treatments if they need it. And at that point, then you're helping keep the community transmission rate lower, and it just makes a healthier community. And they really should be subject to that too. So.
Yeah. So just from both of you, what makes Spectrum any different than any other place that you can go and get this done?
I personally think it's the fact that it's pretty not customizable, but we do really do treatment plans based on what you're presenting at the time and who you are as a person. We understand that some labs that we refer out might be hard to obtain, but they're really critical to your continued care. And so we have some programs that we can help pay for those labs. So further treatment if needed or further care if needed is actually accessible. And I think that that's a big thing that a lot of other places don't have, is that they offer this really great service and they might do a really good job, but the care ends there. And I think that that's something different than Spectrum. Is we have a pretty multidisciplinary team, and we have a lot of resources that we can help refer you or connect you. And if coming into your STI appointment was the barrier was you don't have insurance and you didn't know that we were just donation based, we can help find help with whatever insurance you qualify for, whether that be Medicaid or the Affordable Care Act. And we also can connect you to primary care on a sliding scale if you haven't seen a doctor in a while. And I think that that's one of the best things about Spectrum, is the fact that we can take care of the whole person, even though they came in for one specific issue.
Similar to Allie, I mean, she's one of our community health workers, and I've referred plenty of patients to her finding out if they don't have insurance. I have another patient who needed help getting access to their MS medication, finding out they couldn't afford it. And so I've referred their information to Allie, and, we can look at programs doing that. But also I think Spectrum too, I mean, this is just my personal experience with other providers as well. We tend to dig a little deeper with their patients. We do try to build a really good rapport and conversation with their patients when they come in to get that as Ali said, nearly like personalized, personalized. Can't say the word.
Personalized.
Difficult, but that experience, just for, your specific needs. And, we don't judge, like Ali said, we've seen everything. And like, we believe sex is, a fun thing to do. Everyone should be enjoying if that's what they desire. We don't shame. We just want to make sure you're doing it in the healthiest way possible and the safest way possible.
And it's still part of your physical health. I think that's what a lot of people forget about or tend to just like kind of, be on the wayside. It is definitely not like a subset. Sexual health is still physical health, and it's also mental health if you look at it that way too. But it's very important, and it should be treated as just as medically appropriate as going to the doctor for a physical.
Yeah, and our price point, I mean, healthcare should be accessible, and we're doing our best to do that for our community, our local community. And I think that's one of the most important things we've been able to do, is to make our healthcare accessible. So.
We're going to replay this segment all through the month of April so people can connect. And one of the programs that we'll just take a minute to talk about here is the right time, which you could move into a right time patient from your initial contact as a testing patient. So Ali, if you want to talk a little bit about what that program is and how you could maybe transition into getting additional services while you're here getting tested.
Sure. So the right time, it is a large initiative. It's run through Missouri Family Health Council, and we are a health center that participates in it and offers free or low cost birth control method of your choice, usually the same day. So you're able to come in, figure out, have a comprehensive education on all contraceptive methods, not just the ones that you might think about like an IUD or birth control pills. We lay it all on the table, explain what everything is with medically accurate information, and also take into account what you want beyond pregnancy prevention. A lot of people don't realize that there's lots of options out there, whether you want hormones or whether you want something that's longer acting. We provide that consultation and let you make the decision that's best for your body, and then you're able to usually leave the same day. So that's an awesome program that we are lucky enough to be a part of. And so we are able to pay for it if you're uninsured, and then help with copays if there is a copay on your insurance. So it's a really great program, and a lot of people kind of think that contraception is a barrier method, and it's really not at all. It's completely different. It doesn't protect against STIs. And so we realized changing our intake form to ask the question, what birth control method are you on, if any, and would you like to talk about free birth control? Just by adding that question on our intake form with our STI patients, we've been able to at least have a conversation. And I know, Laura, you've been able to have conversations with people, and even if they have a method of their choice and they're fine with it, they at least know for future reference that one, you can switch methods if you don't like it. You don't have to stick with one for 6 years if you hate it. There's definitely options out there. And then also they know that we're here if they ever want to switch it up, or if they know a friend who might need it. So I know that you've had a few really good conversations with women about their method.
Yeah, I have. I've had pretty wide variety of conversations. I've gone from, like you said, we have that question on our intake form, and that's just a part of when you come in. We're going to ask you, it seems like a ton of questions, but they really do narrow things down for us. But I've had women come in, just the other day I had a patient come in, her and her partner, they don't use condoms, but she doesn't have, birth control she uses. And so we were able to have an idea of like what may work best for her, and, what's her lifestyle like? What does she do for a living? She has a very active job, and so she doesn't have time to, trying to remember to take a pill every day, something that can go. But she goes, at the moment, this isn't what I'm looking for in my life. Later down the line, it's really great knowing. And she goes, now that I know you have this program, I can refer this out to my patients as well, which was really nice. And, those conversations, with a lot of college students, oh, I'm on the pill, classes back to back, it's convenient for now, but, I introduced to her the idea of IUDs. I have that and I love it. I always like to convey my own personal experience, but I do try to transmit, it may not be the same for everyone, but, it can last for years. Just forget it, put it in, you're good. And, some of these do need to have a secondary appointment with our provider, like the IUD. We're not trained as STI testers to do that. We have one of our NPs do it. She's great, but we have a lot of experienced staff who can help out with that too. But we can do counseling sessions for all of them, which is great.
And I think even just having the conversation of, well, what method are you on? How do you like it? What would you like if you could change it? I think just having that conversation helps normalize the fact that it's normal to talk about, and we can kind of have a choice and a say-so with whatever method. And that, like I said before, there's way more benefits to contraception than pregnancy prevention. And I think that might be enough to spark people to be like, hey, well, I think I'd like to talk to you to figure out what's best for me.
Yeah,
the right team.
I think it's important in that when we're talking, I think a lot of people assume that the birth control pill is the only place that they can get those additional benefits. But that's not true. There are plenty of other options that aren't as labor intensive, because you're having to remember and do something every day with the pill. And there are options that free up your time and still give you the benefit.
It's great. I explain it to people as if you're going to the grocery store and you're looking for, soy milk or whatever, there's 15 different options of milk alternatives, and whether or not you like creamy cashew or vanilla coconut mix, that's the same with contraception. There's a lot of different personalization and preference that can go into it that people don't realize. And you should be happy and content with the method that you chose. There's lots of options, basically, is what I'm trying to tell people, is actually sit down and think about what you want out of it and talk to your healthcare provider.
Yeah, it took me 3 different types of pills to go through just to play around. And then finally I was able to settle on an IUD, and I've had it for 6 years now and I haven't looked back. We want to take that time to sit down, and if you don't like it, tell us, that's the thing. We want to get to the point where you're just sitting, sailing along, happy with what you have. So.
Yeah, there are too many options out there to be stuck with one you don't like. Yeah,
and you can change. Like Laura, you said you changed 3 different times. That's totally okay. If you don't like it, or if you find that taking a pill every day is, not good for your organization and memory skills and you're forgetting pills, then you are allowed to switch whenever you want. You can make that decision and figure out what's best for you at that time.
And I think, Allie, you said that we lay out all the options in front of you. She really does. She has examples so you can physically see what the IUD looks like and what the next one on raw looks like. So you can look at it, you can touch it, you know what you're looking at, and touching what may be going into your body for long term. So it takes a lot of the fear and questioning out of it when you can physically see, because how do you know how tiny an IUD is until you actually hold it? Because you see a picture, it's always blown up because they are tiny. So it helps to visualize and maybe make you more comfortable with all of the choices, rather than just feeling like, oh, well, the pill is the least scary.
And I know so many women, and honestly myself included, where IUDs, for making the decision to switch to an IUD, it can be a little scary, and you're in limbo for a long period of time because it sounds a little scarier than it actually is. And once you see it, you're like, that's it? That little thing's inside me? And I think that it's enough for people just to hold off on making that decision to an IUD because it sounds scary when it's really not.
Yeah. But yeah, I think, all of this conversation just really focuses around some of our core stuff with the agency is that sexual behavior and sexual experiences are a part of life. They should be safe and consensual and fun. And as long as you're doing all those things and you can keep everybody safe and healthy in the process, that's what we want. We want to provide information to keep everybody safe in the process. And that goes with, family planning and contraception as well. If we can add another layer to this, keeping you safe and on track and on your plan for life, those are the tools we need to provide. And we're really excited to be able to do that.
I think that that's a good way to put it. And we really will help you with a lot of things that are in this health sphere, and sexual health is a part of it, but it also is bigger too. So we help connect the dots to all of those things and kind of look at the big pictures.
And, should the plan deviate and there is questions around sexual assault and violence, sexual trauma, all of those things, if we cannot handle it internally, we have all the referral sources that can assist with that, and we can make sure that that happens. We can make the initial introduction. So even if you're feeling stuck or scared or don't know where to go, we're a great resource for that. If the person who you're talking to at first doesn't immediately have the answer, by the time you're done with that interaction, you will have the answer. There are enough of us that we team problem solve all the time. So we will be able to answer and refer and support the best way that we can. Because again, we want to get everybody back on track and happy and healthy.
And just since you mentioned sexual assault and abuse, I do want to mention that if you are if you had recently had a sexual assault or were a victim of sexual abuse, then if your choice is to go and get a rape kit, you would need to go to the emergency room. We do not do that.
Mm-hmm.
We are not equipped for that, and that really would require emergency care. But even if it's less than that 5-day window of sexual assault and you're not looking to do the rape kit and go the legal route, you just want to be safe and secure and your brain's running a mile a minute, it's okay to come get that testing a few days before that testing window. But also we'll probably tell you in that time that we're glad you came in to get tested as soon as you felt comfortable and ready to do it. But it also might be medically necessary for you to come in a week from now to get a secondary test just to make sure. And so I would like to put that PSA out there for anyone.
Well, before we wrap it up today, do you have anything else you want to add about testing or prevention while everybody's out on spring break?
We would love to see you before you come to us and tell us about all of your symptoms. Come to us as a normal preventative, quick 15-minute appointment as part of your normal routine every 3 months or with an addition of a new partner. That would be awesome if we got more people who came in for truly routine. So that's my big thing.
Definitely that, but it is spring break, and if something happens, next week and a half after, we're excited to see you, excited to meet you, and start a new relationship with our clinic with you. So,
because maybe you need to come in and get treated, and for you to be like, oh wow, like this can happen at any time, and I had no idea. So maybe that's just enough for you to turn into a routine visitor.
And I would say that if you are worried or nervous, no amount of the three of us sitting here telling you you shouldn't be worried and you shouldn't be nervous, it'll be a positive experience, is going to make that go away. So if you need to bring along your own moral support, we're cool with that. You can make a group effort to get your testing done. But however it needs to happen, we just really encourage to work that into your routine, because if you're just doing it as routine, it won't be freaky, you won't be nervous, you'll know what to expect, and then if something happens, it's easy to take care of. We want to,
and you know your timeline. If you came in January and you were fine, nothing, and then you come back in July and something's different, something came back positive, well, now you have a smaller window of people and time that you can help narrow that down to. So it really is us helping you. So
yeah. And on the bottom of your screen, you see the 514-7312 number, and that's where you would call to schedule your appointment. You need to also budget a few minutes into your time, because there's some paperwork that you're going to have to complete when you come in. So just be prepared for that. Results, depending on what type of testing you're getting, kind of a 10-day window for results. There are ways to expedite that, but then there are costs associated with expedited testing, because the lab is charging us and we charge you the same amount that the lab charges us. We're not, inflating prices. So there are those options. So yeah, if you're out there and you're concerned, if it even crosses your mind, go ahead and give us a call. Set up the appointment. It's quick, and you're in, you're out, and you have peace of mind. So.
And even if it turns out that it was just, a burning, itching, and a UTI, and your results come back negative, at least you now have a baseline. So think about it that way.
Yeah. Well, thank you, everybody. If you have questions that you need answered, you can always call us, or you can send them to info@spectrumhealthcare.org. And all those info@ questions come directly to me. They're not just a general email that everybody in the building sees. Those all come directly to me. I'm the only person who sees them. So if I can't answer the question, I can certainly forward it on to the appropriate person, so you don't have to feel like you're sending questions into this big, massive pool that the whole world sees. That's not the case. But yeah, we covered a lot of information. If you've got questions, send them along to us. We're more than happy to do that. But in the meantime, we will be back live with you next month when we cover another topic. So please plan to join us then. For now, have a great rest of your spring break if you're on break, and we'll see you later. Thank you both for joining us. We'll have to do it again. Thank you.